Now, when it comes to humanitarians, it's not that bad as it is for Gaza. But I've seen my colleagues coming back from Gaza, WHO colleagues, who have been crying for the first time in their life, saying that have never seen something like that in all the previous missions they have done.
StratNews Global and Global Compass is very, very honored that we have the spokesperson of the World Health Organization, Mr. Tarik Jasarevic, joining us all the way from Geneva. Mr. Tarik Jasarevic, thank you so much for taking out the time to speak to Global Compass.
Thank you for the invitation.
My first question to you is, could you give us a little brief on the ongoing health crisis that have affected the refugee camps in Gaza and the neighboring refugee camps, especially when it comes to the health of children?
Well, the situation, unfortunately, is not getting any better for anyone in Gaza. The health system has been systematically dismantled in the past months, leaving people of Gaza without access to health services. And here we are really talking about everyone, not only children, not only pregnant women. Really, everyone is deprived of one of the basic human rights, and that's the right to health right now in Gaza. Why? Because only 16 out of 36 hospitals are partially functional. Many hospitals have to close because of evacuation orders. People are being injured on a daily basis and cannot receive medical care because hospitals do not have enough of fuel, do not have enough of specialized staff, do not have enough of medical supplies. We as a humanitarians cannot move the way we would like throughout Gaza, so we cannot provide that assistance. Beside of people who are injured, you have people with chronic diseases who cannot access their medicines, pregnant women who cannot get access to prenatal care, and on top of all of that, you have infectious diseases that are spreading because people are living in a very unsanitary living conditions right now.
Yes, and in fact, the most alarming thing is an outbreak of polio among children, and that is definitely a huge threat because there are regions and countries who have controlled cases of polio in their countries. They have eradicated polio, but now with children getting afflicted with polio, how do you see this as an impending threat to other countries?
Well, unfortunately, this was predictable when you have a situation where immunization numbers have gone down. Gaza had a really good immunization numbers until up to beginning of the war. Now, these immunization rates obviously fell down. So you have a number of young children who are either under-immunized or not immunized for polio. And then this creates conditions together with people living in unsanitary conditions where there is no access to clean water and to sanitation, creates the risk of spread of polio. We have samples that have tested positive in sewage, so we have to enhance surveillance for acute flaccid paralysis, possible cases that are caused by polio, among other infectious agents. And then we need to make sure that children are immunized. But again, this adds up to already long list of health threats for children in Gaza. So it's just yet another issue that health workers are trying to do something to deal with. And we have to really commend the resilience of health workers in Gaza who are trying every time when possible to go back to their place of work and to resume some of the services they had to abandon, despite the fact that they have been displaced multiple times with their families and they have suffered losses as well.
I'm sure the WHO is dealing with the tactical issues on a day to day basis, the challenges. But Do you have a plan in mind when it comes to the long term health challenges? And what kind of support do you require from the global community for this?
Well, we need a ceasefire. It's as simple as that. First, people of Gaza need security. They need to not to be bombed anymore. They should try to get back to rebuild their homes and to have a normal living conditions. When it comes to health sector, the level of destruction, of physical destruction, is such that it will take a long time to rebuild roads, to rebuild hospitals, health centers. But health workers in Gaza have shown resilience before, so they would be ready to start working and resuming some of the health services that they were providing. But they need security and they need help. So we as a humanitarians, we will be there to help health system in Gaza to rebuild. But for that, first of all, we need a ceasefire. In the absence of ceasefire, we need to have that humanitarian space so we can deliver what we can deliver to health facilities. Unfortunately, in the past, what we have seen is that every time WHO or other humanitarians we try to go to reach hospitals, our requests are being denied. There are long delays. Unfortunately, roads are almost non-existent anymore. So there are huge logistical challenges and operational challenges for us to help. And you can imagine how it is that for health workers of Gaza who cannot access their place of work, patients who cannot access hospitals because of the security, because of the infrastructure damages. So this all makes the situation just worsening by day. What we need is access. We need humanitarian space, but eventually we need a ceasefire.
But peace doesn't seem to be anywhere near in sight, and it's just going on. It's relentless. The attacks and the bombings and the violence are relentless. How long do you think it can be sustained? The Gaza, how long do you think the situation can actually be sustained? And how are you, keeping the morale of your own health workers there and also the local community is in Gaza? How are you keeping them motivated?
Well, when it comes to WHO stuff, we are there, we have been there, and we will stay there, and we will do the best we can. And as I have said, the some 20,000 health workers in Gaza have shown resilience in the past, and we see every day heroic work that trying to do, going back to destroyed hospitals, trying to clean up some rooms to be able to see patients again. No one knows how long this will go for. We are not politicians, we are humanitarians, but our job is to show to the world what is the situation, what is the suffering right now of people in Gaza, and hope that this will help make political decisions that are needed to stop really not this horrible nightmare that people of Gaza are going through.
It's a nightmare indeed. But as the spokesperson of the WHO, could you give me a little bit of information about how the WHO is advocating for the protection of the healthcare the facilitators, the healthcare workers who are stationed in Gaza? How are you, advocating for their protection?
Well, we are mandated to report first, to verify, then to report attacks on health anywhere in the world. So we have a system in place. We have a dashboard that it's on our website showing attacks on hospitals, health workers, ambulances, health workers, patients. And so far, for example, we have already verified for almost 500 attacks on health in Gaza. And in these attacks, 747 people have been killed. So 110 health facilities have been affected. 32 hospitals have been damaged. 115 ambulances have been affected and sustained damage. So we are looking into attacks of health. What we are saying really that health should never be a target. Health workers should be able to do their job while in safety. Hospitals should be safe haven. They should never be attacked. They should never be militarized. So we are seeing unprecedented attacks on healthcare in different parts of the world, but especially in Gaza, we need really to get everyone to understand that the protection of health and health facilities and health workers is a part of international human rights law, and that all the sides to the conflict should respect human rights law and protect health in general when it comes really to creating the space where patients and health workers will feel safe.
With the assassination of Haniyeh in Tehran, do you think that somewhere the focus has almost shifted out of, the civilian health crisis is no longer a focus? Do you think the focus has gone on the regional conflict between Israel and Iran?
Well, this is the question you should ask to media who are presenting news in a way they do. We want to make sure that that the health situation in Gaza is being described, is being talked about, because we cannot allow such a suffering of 2 million people, and we need to find solution. We need to fight to get what we need to be able to help health system in Gaza. So obviously, we have seen in the past that in any conflict there is a sort of a fatigue after some time. But our job is to make sure that we keep, and we appeal to media as well to not turn away from this horrible situation and situation where 40,000 people have been killed, majority of them women and children, in the past 10 months. So we really need to keep focus on the situation in Gaza.
You talked of the resilience of the healthcare workers over there, and of course, one knows that there has to be a certain amount of resilience. But then something like this, witnessing the deaths, witnessing the helplessness, the lack of access to healthcare, to medicines, to treatment, I'm sure that has an impact on the mental health of of the workers who are stationed there. Do you have any reports of that? And is there something that the WHO is doing to take care of the mental health of not just the workers, but also the patients at Gaza, the people who are being treated? Mental health issues could be an additional trauma.
Indeed, we have studies that have been done in a different conflict areas in the past, showing that during conflict, people are many more times likely to develop mental health conditions than in a normal setting. So we know that people of Gaza, everyone in Gaza, is under such stress that this may have a long-term mental health consequences. So not only health workers, but everyone. Can you imagine how it is for children who have to be displaced, who are living in tents and have to go and listening to the bombs and not having enough of food, not having clean water. So all of this is horrible, and this is why it has to stop. Now, it is something that will present a challenge in the future, but we are also dealing with a really day-to-day health needs that have to be addressed immediately. For example, there are 50,000 pregnant women with 180 deliveries per day. So we need to provide that prenatal care. These women have to have access to intensive care in case of complications. There are 2,000 people that are diagnosed with cancer each year in Gaza, many of them children. There are 1,500 patients in Gaza that they need kidney dialysis 3 times a week. And now there is not enough machines to provide this dialysis. So we had to reduce the number of dialysis sessions. There are people with cardiovascular diseases. There are people with a high blood pressure. And then there is also people who need to be evacuated to receive care because they can't get it. And now evacuations are almost gone to zero since Rafah crossing has been closed. So indeed, mental health is a big issue. So just before the conflict, there have been almost 500,000 people in Gaza with mental health disorders. Now that number will probably grow, and we need to take care of those people. So we should look mental health as an integral part of health services. So if the reduction of provision of health services is happening everywhere, obviously it's affecting mental health as well.
And also the mental health of the healthcare workers over there, right? I mean, how are you dealing with that? I mean, do you have stories, do you have reports coming back of how it is affecting them also?
No, but can you imagine how it is for health workers in Gaza again, because they have been displaced, they have lost members of their family, and at the same time they are trying to go to destroyed hospitals and try to get some work. Now, when it comes to humanitarians, it's obviously it's not that bad as it is for Gaza, but I've seen my colleagues coming back from Gaza, WHO colleagues, who have been crying for the first time in their life, saying that have never seen something like that in all the previous missions they have done. So this level of destruction, this level of suffering, is something that obviously must have consequences and has impact on everyone who actually sees it.
I wish I could take away a sliver of hope, some positive aspect of this entire interview, but it seems so bleak. But then again, I'm going to ask you this: uh, what can the international community do now? Of course, pressurize for a ceasefire is something you've already said. What else, when it comes to providing healthcare, providing immunization? What else can the international community do?
I think you already said it. Push for the ceasefire at any possible level, because that's the only solution. We have our supplies on the other side of the border. We have people who are ready to help. Not only WHO, there are a number of emergency medical teams from different countries that are working inside Gaza, and we are all ready to continue. But for that, we need humanitarian space. We need to be given access, and we need to be able to move from point A to point B. For example, you mentioned polio. We want to immunize children for polio in Gaza, so we avoid scenario of having actual cases of paralysis in children. But for that, can you just imagine that you need to bring vaccines inside Gaza, which is probably
We
not
need
the most difficult thing.
safe corridors.
How to once you have these vaccines, let's say inside Gaza, how you organize to get to children? Where are
Exactly.
those children? How we can get to them? Who is going to vaccinate? With all these evacuation orders, so we need, if not ceasefire, we need at least couple of days of tranquility, so we can do that. And again, those are political decisions that we as a humanitarians unfortunately can influence only by public speaking.
Yeah. Absolutely. And I really hope that what you're saying is heard by more and more people and some action is taken, because, it seems like nobody's seeing any sense. And the world seems to have lost its own humanism, human empathy and helping people and kindness is what makes us human. These are actual human values, and that somehow seems to be getting lost in this entire situation. But thank you so much for speaking to us, Mr. Yasharovich. And I really wish you and your team more resilience. And I really hope that the international community gets together and something happens. There is a sliver of hope. There are safe corridors for treatment to reach the people. And finally, of course, a ceasefire can finally happen and the world can see peace. Thank you so much for taking out the time to talk to us.
Thank you very much.
Thank you, sir.